In this video, which is the first lesson, we are looking at why prevention is important, why prevention is key, why you should adopt prevention over cure. And I'm going to give you 5 reasons why you should take prevention very seriously. The first reason is that some medical conditions are not medically curable and they are very difficult to manage. So this is what we call knowledge limitation, human knowledge limitation, or scientific knowledge limitation. We know that science is a work in progress, so it does not have all the answers at a particular moment in time. So when your health provider or health practitioner tells you that a disease like hypertension or diabetes is not medically curable, that person is not speaking his or her own mind or opinion. That person is speaking the mind of scientific knowledge. Available knowledge, or the most credible source of information or knowledge on the disease hypertension or diabetes, have not suggested a cure for the conditions hypertension or diabetes yet. And no practitioner, no person can suggest a cure for a disease that medical knowledge or evidence-based knowledge has not yet found a cure for. So for such conditions, the goal is that you try to manage such that you are preventing worse outcomes like complications from hypertension or diabetes, like a stroke or heart disease or kidney failure. And when it's a cancer, they are trying to slow down the progression rate or try to make the person's life comfortable and so on and so forth. Okay, in such cases, your goal is to prevent the disease, because in all parts of the world, you are supposed to be told the same thing, that hypertension or diabetes, for instance, are not curable. Number 2, the second reason why you should adopt prevention as a strategy over cure is that there are some medical conditions whose management are not available in your jurisdiction because of the fact that you live in an area that is a low resource setting. So you probably don't have transplant services readily available to you. So you don't have kidney transplant services. You may not even have services to some emergency conditions like a heart attack or stroke. And I mean services such as creating clots responsible for the stroke, clots responsible for a heart attack, for instance, or creating a bypass for blood flow in a heart attack. So in such conditions, when you have them in a developing country, you might find it difficult to survive because of lack of expertise, lack of facilities, lack of equipment, lack of emergency responses that can swiftly deal with such conditions. So you have to prevent certain conditions because their managements are not readily available in your jurisdiction. So such managements are not readily accessible to you. Number 3, the third reason why you have to adopt preventive measures is because there are some conditions that you cannot afford their management. So even though there's definitive management for kidney failure, there can be a transplant service. Even though there can be dialysis that can be offered as an option, you may not be able to afford these services or management modalities. So as far as you are concerned, they are not accessible. They are not financially accessible to you. Okay, so you have to prevent such diseases from occurring to you. Number 4, the fourth reason why you must adopt prevention as a strategy is because disease and illness come with some burden to you as a person and to other people. To you as a person, disease comes with physical pain and discomfort. So if you have a heart disease, you'll be short of breath most of the time with very little effort. You're short of breath with exertion. If you have a stroke, you are bedridden, or you have a weakness in your limb, or you have challenge speaking, you're going to have some disability, some loss of function. So disease comes with some physical discomfort, some disability to yourself. Disease also comes with some psychological disturbance or psychological problems There are people who are depressed or have anxiety or are worried or afraid because they have a chronic disease like hypertension, diabetes, or a stroke or a kidney disease that they are afraid that they are going to die. So it makes them anxious, worried, and they are not able to sleep. So disease comes with some psychological disturbance or stress. Disease also comes with some social burden on other people, on close contacts, on families. Because if you have a stroke and you have lost function because of you cannot walk, you might need people to take you to the hospital, to wheel you in a wheelchair. You might need people to take care of you, to bathe you, to feed you because your limbs are not functioning. That is disease acting as a social burden, a burden on other people. The disease can also act as financial burden because money that you should have used to take care of yourself, take care of your family, take care of your children, take care of other important needs that border on your survival as a person in your family is being spent on healthcare and expensive medical treatment. So disease comes with some financial burden. These are reasons why you should take prevention very seriously. Then number 5, the fifth reason why you should take prevention seriously is because healthcare is a preventive practice largely. So the goal is that you don't get to have a disease. But if you have the disease or the illness, then we want to provide treatment or a cure for it. Okay. And if you hear about vaccination, for instance, vaccination is to prevent diseases. Antenatal care is to prevent pregnancy complications or delivery complications. So healthcare is a preventive practice largely. Okay. So you must adopt prevention as a strategy over cure. All right. So this is the first lesson, 5 reasons why you should adopt prevention as a strategy over cure. I will entreat you to move to lesson number 2, where we talk about the top causes of death worldwide. So you get to know the diseases that are most burdensome and life-threatening to the human being that you can prioritize in preventing.